Well, hello, my good people. How is everybody doing? I am back this week. As you know, we are in the last week. Well, pretty much the last week because Monday is the last day, but this is the last full week of February, which is Heart Awareness Month, Heart Disease Awareness Month. And as you can see, I'm wearing my red today to represent the heart. So I am here today to share with you signs that can tell you that you could potentially be having a heart attack. All right, so it's important when it comes to the heart to know the signs and symptoms of a heart attack, and it's important not to ignore those signs and symptoms, because if you do not take quick action, it will determine if you will live or die. Okay, so this week I'm going to be sharing with you some signs and symptoms that will tell you that you could potentially be having a heart attack. All right, so remember last week, this week I've been sharing about heart disease, and last week I shared with you that the most common heart disease is coronary artery disease. And what that means is that with coronary artery disease, there is decreased blood flow to your heart. And this happens as a result of plaque build up inside the walls of your arteries, which are the arteries are vessels that transport the blood back and forth to your heart. So when plaque builds up inside those walls as a result of sometimes things that we eat, or it can be hereditary, that cause your cholesterol level to be high, this plaque buildup can cause those arteries to narrow, meaning it becomes smaller, and it can decrease the blood flow to your heart. And when that happens, it increases your risk for getting a heart attack. Right? Heart attack is a very serious condition. If you are having a heart attack, or if you are near someone that is having a heart attack, it's important that you know what those signs and symptoms are and what to do in order to save the person's life, because it is a life and death situation. So, how will you know if you are having a heart attack? That's very important. I'm pretty sure every one of us wants to know it. But how do I know if I'm having a heart attack? So most people, the first thing that most people may feel, which is pretty much across the board, is you will probably have pain in your chest. There will be pain, pressure, or just this squeezing feeling in your chest. Some people describe it as you feel like an elephant is sitting on your chest. And this chest pain can happen with or without trouble breathing. All right. Sometimes when you have this chest pain, you hold your chest, you may have shortness of breath, so it will be hard for you to catch your breath. All right. So in addition to this chest pain, some people may have stomach pain, which is called abdominal pain. You may feel sick to your stomach, like you want to vomit, or you may actually be vomiting. You may feel lightheaded, and then you will break out in this heavy sweating. Sometimes you have back pain, and you may have neck and jaw pain as well. Okay, so those are some of the symptoms, pretty much the most common symptoms that you may be having that will signal to you that you are having a heart attack. Now, this pain, the chest pain, may also go down one of your arms. Some people will experience it in your back. That's what it's called, radiates. So sometimes you ask, when you call your doctor and you say, I'm having chest pain, or you go to the emergency room and you say, I'm having chest pain, they will ask you, is this pain radiating down one of your arms? Is it going to your back? They're trying to see if you are having a heart attack. All right. So I was trying to get a diagram that can really help you understand what I'm saying. So I found this. Now, this is not my own. I don't own no copyright to this. I just went on Google, like always, and I was able to find this diagram to depict exactly how the symptoms of a heart attack will look like. So if you can see this guy over here, he's holding his chest. That's the chest pain. And then in the middle is the pain may radiate down one arm. And then over here, you may have the neck or jaw pain. This one right here is the trouble breathing. You may be lightheaded, or you feel like you want to faint. And then you may have this squeezy, nauseated feeling in your stomach. All right. Now, the key thing to know if it is a heart attack or not is all of these symptoms, or maybe not all, maybe one or two of them, it happens suddenly. So if it happens suddenly and if it does not go away, but it just get worse and worse over the hour, the next hour, this pain is getting worse and not reducing. And then maybe, let's say if you're not so sure and you decide to wait, oh, let me see if it will go away by tomorrow. But instead, it's just getting worse and worse and worse. Please do not delay. Quick action is very important to save your life. It will determine if you will live or if you will die. All right. So the chances are, if you have these symptoms and it comes on suddenly and it does not improve, but it gets worse over by the minute, by the hour, by the day, know that the chances are you are more than likely having a heart attack. So please, my people, do not ignore them. Don't delay in seeking medical care or medical treatment. If you or anyone you know, if you are near somebody that tells you that they are having those symptoms, or if it's you yourself, please call. If you are abroad or somewhere where you have access to calling an ambulance by 911, call 911 immediately, so you can get an ambulance to take you to the emergency room as soon as possible. Don't try to start calling around to see if somebody can pick you up to drive you, because you don't want to delay in treatment. Study shows that the earlier you have to get treatment for a heart attack within 1 to 2 hours, just to get them to avoid any damage to your heart, or worst case, you die. All right. So for my women out there, my fellow women, let us be careful, because according to the American Heart Association, heart attack is the #1 killer of women. And for women, sometimes, so study shows that the symptoms of a heart attack in women are sometimes can be very mild. So we will most likely attribute it to like indigestion or some type of abdominal issue. So for my fellow women out there, if you find yourself having acid reflux, you get short of breath, or you feel pressure in your upper back, like a squeezy feeling that followed by you being lightheaded. Again, the key is, if these symptoms continue to get worse and does not improve by the hour, by the minute, by the day, please do not delay. It's better you get to a healthcare facility as soon as possible by calling 911, so they can do the necessary tests that is required to let the medical professional determine that you are not having a heart attack or you are having a heart attack, so they can get appropriate treatment on board. So as we are in the last week of February, I just thought to bring this to you, because heart attack is very important. It's a matter of life and death. So don't ignore those symptoms. If you have any of those symptoms that are outlined to you, chest pain or discomfort, crushing, sudden chest pain followed by shortness of breath, the pain is radiating to one arm or your lower back, you feel nausea and vomit. Nauseated means you just feel like you want to vomit, or you actually start vomiting, you lightheaded, you break out in heavy sweating, neck or jaw pain, any of those symptoms, please, my fellow people, we only have one heart. It's difficult as it is to get any type of organ transplant. People that have kidney failure can be on that transplant list for 7 to 10 years. Not many people, they're like, the only way somebody can donate their heart to you, unless if they, I don't even know if that, unless maybe because once you die, your heart stops beating. So we want to really take good care of our heart. Okay, so I'm just bringing this out there to all of us, myself included, to pay more attention to our health and take our health very seriously. And again, as I leave, how are you caring for your heart? So we are in the last week. Let us pay attention to ourselves and take care of this body that God has blessed us with. It is our responsibility. Be blessed. Take care. Bye, everybody. And thank you all for watching my video. You can follow me also on my YouTube page. It's called Health Talk with John J. Thanks again. Bye. Be blessed. And I love you all.